Hi, my name is Magdal Mercado, and I'm going to talk about the COVID-19 from my essay for this work. So, the coronavirus pandemic, also known as COVID-19, has had an unprecedented impact around the world since its appearance at the end of 2019. It affects millions of people around the world, leaving a large number of deaths. At present, the concept of health is understood as a complete state of physical, mental, and social well-being, and not simply the absence of disease. However, the pandemic has exposed the shortcomings of the health system, especially in countries with less developed health systems and is those that have faced high caseload. This definition of, of health is the one that gives the OMS. The OMS give this definition of health. So, to continue, the medical advance in the fight against the pandemic has been significant, since we were able to observe how to improve the preparation of the medical history and how to be able to make these histories without necessarily being close to the patients. This is known as telemedicine. The pandemic has also had an impact on society at large, affecting the most vulnerable groups, the elder people with pre-existing conditions and marginalized communities. The need to improve access to healthcare and the need for a more coordinated and collaborative approach to addressing public health challenges were noted. In terms of medical advances, telemedicine, as I said, was created, which has become an increasingly important tool in medical care, allowing doctors to care for patients remotely. In addition, biotechnology research and global collaboration to find treatments and a vaccine for the coronavirus were promoted. Although despite the advances that I mentioned before, lack of resources, coordination, and preparedness were some of the main challenges that health systems had faced around the world. For example, is the lack of the personal protective equipment, known as PPE. The pandemic has also led to debates around mandatory vaccinations and the inclusion of medical records in passport applications. Some countries began to implement mandatory vaccination policies for certain groups, such as health workers and university students, as well as on passports to observe that they have their vaccinations in advance, like in this image with a QR code. The inclusion of medical records in passports applications caused uncertainty around the privacy of personal information. Despite this, many countries have adopted the policy of including medical records in passport applications, which has led to greater efficiency in the management of public health emergencies. Because of the pandemic, social distancing restrictions and the need to work and study from home have transformed the way people communicate and interact, which in turn has led to an increase in demand for mental health care and services. In terms of scientific research and medical technology, there was an increase in investment in biotechnology and in the search for treatments and vaccines for COVID-19. Such research has demonstrated the effectiveness of vaccines in reducing the spread of the virus, leading many governments to adopt mandatory vaccinations policies and the creation of mass vaccination programs, and in the postmarks, as I mentioned before. It is important to note that the impact of the coronavirus pandemic will continue to be assessed for many years to come, as countries continue to work to prevent future public health crises. Significant changes in medical practice and the health system are expected, as the new technologies are developed and new treatments and therapies are discovered. It is important that governments and health systems are prepared to adapt and evolve to meet the needs for the populations or of the populations. In conclusion, the coronavirus pandemic has had a significant impact around the world. It has exposed the shortcomings of the health system, driven to medical advances, and led to debates around mandatory vaccination policies and the inclusion of medical records in passport applications. While it is difficult to predict the long-term impact of the pandemic, as I mentioned above, significant changes in medical practice and the health system are likely to occur in the future to better address future challenges.